Hi guys, welcome to the You Are Not Broken podcast. Today I'm super excited to have board certified urologist Dr. Pohlman visit me online. We're doing an interview today about his expertise on sex after prostate cancer treatment. And Dr. Pohlman is in private practice in Nebraska, but I've known Dr. Pohlman for a long time. We did our urology residency together and we share the same birthday. So I think that we've bonded over several things here. So I'm super excited to have my good friend, Dr. Pohlman. We're going to talk about the challenges couples face in dealing with the potential side effects of prostate cancer treatment, as well as potential options available in helping restore a healthy sexual relationship. So I know that this podcast is usually geared towards women and women's pelvic health and sexual function, but the majority of women have sex with men. And one of the most common cancers for men is prostate cancer. And prostate cancer happens at a time of the life where women are having their own challenges with sexual function, usually in the midlife or 60s, 70s, and above. So to have both partners be challenged is really a stressful time for a lot of people. And I'm super excited to have Dr. Pohlman here to give and share some of his expertise in treating prostate cancer and talking about the potential side effects. So the other thing that Dr. Pohlman has done kind of on the same trajectory that I've done is we've both started podcasts, and his is geared towards prostate health. So he is the founder and host of the newly launched Prostate Health Podcast. And with this podcast, he's helping men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions. He's an expert when it comes to prostate cancer, including counseling men and their significant others regarding potential side effects following prostate cancer treatment. Dr. Pohlman, welcome to the show.
Thank you, Dr. Casperson, for having me on the show.
So, Dr. Pohlman, the mission of You Are Not Broken is to empower women to live their best love lives. And we want to talk about men and not neglect them, because men are very, very important in women's sexual relationships.
That is correct, Dr. Casperson. Even before men undergo radical therapy for prostate cancer, whether that is surgery or radiation, many men already have baseline sexual dysfunction, including inability to obtain adequate erections, which could be secondary to numerous factors, including but not limited to aging, heart disease, high blood pressure, and diabetes. And with treatment for prostate cancer, the nerves that help with erections can be damaged, and some men have diminished blood flow to the penis as well. Some men also require hormonal treatment, that's called androgen deprivation therapy for prostate cancer, which reduces a man's testosterone to low castrate levels, and this may cause a loss of libido or sex drive. Now, the other change to expect is that there will not be any ejaculate anymore with orgasm after prostate cancer treatment. With surgery, that happens immediately, and with radiation, it can really decrease gradually over time. Again, the nerves that help with erections are actually attached to the prostate capsule, which is why they're so easily affected with radical prostate cancer treatments. Now, some men are candidates for nerve-sparing surgical approaches. And what that is preserving these delicate nerve bundles, even with a nerve-sparing approach. There's still potential for damage to these nerves. During surgery, these nerves can be stretched and bruised, ultimately affecting initial sexual function after treatment. Sometimes this recovery of sexual function can take up to 6 to 9 months for recovery, even as far out as 2 years before sexual function is recovered. And even then, there are no guarantees. About 50% of men at 1 year out will still be having difficulty obtaining adequate erections. Men who have a better chance for full recovery are younger men, less than 65 years old, who have had good function going into their treatment for prostate cancer, compared with someone already having issues with erectile dysfunction and someone who is older.
Dr. Pohlman, why do men have decrease in erectile dysfunction as they age anyways?
So as they age, there's certain factors that can affect the nerve that control this, as well as the blood supply. And any one of those things that can be affected can cause difficulty with erectile dysfunction. And oftentimes that's seen with aging, heart disease, high blood pressure, and diabetes all can affect potentially the nerves and blood flow to the penis.
What about smoking cigarettes or marijuana?
Yes, that those two can affect, not only the vasculature, but also the nerve supply to the penis, and it can affect erectile function. So
I often think they should put on cigarette packages that, they should put on there something about erections being affected.
yes, that would be nice.
That help people not smoke. So what do you see when it comes to men's partners in relation to sexual function after prostate cancer treatment?
Yes. Well, we certainly see frustration also with the man's partner, as you mentioned, in dealing with this dysfunction over the course of 1 to 2 years after treatment as they're dealing with this. And depending on the age of the partner, there may also be issues with vaginal dryness and pain with intercourse secondary to changes related to menopause. There's often decreased affection among couples. So it's really not just all about the man following prostate cancer treatment. The partner can be significantly impacted too. The unfortunate thing is that a lot of times, in terms of follow-up, when we're seeing these men back after prostate cancer treatment, they're coming in alone to their post-treatment visits. So I think a lot of times we're really losing a good opportunity to assess the dynamic and miss out on good counseling opportunities that they both really can benefit from, which is why it is best to really encourage couples to come in together, if at all possible, for these appointments. It is important in focusing on restoring sexual health for both partners, not just the man. And I really see better outcomes in terms of satisfaction in those that are more open to discuss these issues and involve their partner in these discussions.
That's a really good point. I think a lot of people and a lot of urologists want to see the partners in the early discussions of prostate cancer treatment. I always tell men, if your wife's not happy with your decision, you're not going to be happy. Especially in the setting of active surveillance, right? So if some active surveillance is knowing that you have a diagnosis of prostate cancer, but not actively choosing a treatment at this time. A lot of women are actually very uncomfortable with that because they have this kind of sense that there's cancer that's not being treated. And I think if they come to the visits and actually understand the science and the plan behind active surveillance, they're going to be a lot less stressed and a lot more comfortable with the man's decision. And kind of playing that forward in the years after treatment, if they're not there to talk about sexual function, if it's important or not in the relationship, you are missing out on that opportunity to kind of facilitate that discussion with the couples.
Certainly. And I think it really is helpful I know once the prostate cancer diagnosis is given, there's a lot of anxiety and stress regarding that. And, a lot of men just want to get it taken care of. They're so focused on getting the prostate treated that if we can have some of these discussions about some of the sexual side effects and what are some of the options, even before they're treated, I think we'll have better outcomes when it gets to that point after treatment as well.
And I think certainly talking about the sexual side effects up front helps men to kind of prioritize where they are in their treatment kind of spectrum. Really talking to people about the risks of erectile dysfunction with low-grade prostate cancer might kind of let them delay and kind of be part of that more active surveillance program that a lot of men really are electing at this, this year in cancer treatments. Active surveillance is becoming more and more common, especially if you say, let's preserve your sexual function until this cancer really looks like it needs to be treated. If you don't bring up those side effects or the importance of that to them, they might be only fixated on treating the cancer versus looking at it more holistically.
Yeah, certainly. I definitely agree with that.
So what are some options for men and their partners in helping regain their sexual function?
Yeah, so I've certainly seen a broad spectrum of outcomes following prostate cancer treatment, including men already having erections immediately after surgery, still with their catheter in place, to men still struggling 1 to 2 years after treatment. So intimacy is certainly important regardless of age, and intercourse is not necessarily required to have intimacy. For those needing help regaining erectile function, there are definitely options to consider. We often refer to this as penile rehabilitation, and there's various options that come with this. The first option is utilizing what we call phosphodiesterase inhibitors. That's your Viagra, Cialis, Levitra. These are oral medications that help increase blood flow to the penis by relaxing muscles and arteries in the penis. Now, there's not the best data supporting this in terms of penile rehabilitation, but at least we're doing something. And so we can have men taking, especially once they regain their urinary control, after we get the catheter out, get men on taking one of these medications a couple of times a week, even up to once a day.
You're talking about taking that medication not as how we think about Viagra, which is on demand an hour before sexual activity, but you're talking about it more like a multivitamin or maybe just a chronic medication of you're taking it for the health of the penis.
Correct. And now, while they may not be actually having an erection while taking that medication, there's still some thought that it's still helping with the nerve recovery, maybe some of the blood supply, maybe even with some nocturnal erections at nighttime while they're sleeping. So certainly, as long as they're tolerating the side effects or they're not experiencing many side effects with taking that medication, it's something to consider. So another option, and this can actually be done in combination with the oral medication, is a vacuum erection device. So what this is a contraption that is placed over the penis, which helps kind of vacuum, so to speak, or pull blood into the penis. And these can be a manual pump or a battery-powered device. And it can really be used to help start getting blood flow into the penis and help recover penile length. And what you're doing is you're kind of stretching the penis as well. And we can have guys doing this several times a week, even in daily, to kind of help get the blood flow going. Now, this device also can be used to have intercourse as well. They typically come with a constriction device or a ring that's placed at the base of the penis, because once the blood is pulled into the penis, as soon as you take that vacuum device off the penis, the erection is going to go away. So how the blood is held within the penis is with a little ring that's placed at the base of the penis to assist with having intercourse. So one of the other options, a more potent medication, is what we call intracavernosal injection. It's a self-administered after it's been taught to the patient, but it's self-administered injection. Now, this can be somewhat scary for men, but with some teaching and some counseling, men can become quite comfortable in doing this on their own. And what this also does is it helps increase blood flow into the penis. These come in either a single agent form versus a multiple agent form. Probably the most common one used is called Trimix, and it has different components called alprostadil, phentolamine, and papaverine. And oftentimes it has less pain than the single agent alone, and that's the alprostadil. And so again, it's kind of a step up from the oral medications and the vacuum erection device.
I've heard of these as far as alprostadil being a cream that you can place on the skin of the penis, and then also little like birdseed pellets called Muse that you can put in the tip of the penis. Are those still used? Is there evidence to say that those work at all?
You know, I think there's some urologists that are using them, but I just haven't had very good success with that strategy. So a lot of times we'll just kind of skip over go with the oral medications, the vacuum erection device, and then if those aren't satisfactory, then going straight to the intracavernosal injection. And then lastly, there is the penile prosthesis, and this can come in both a malleable or an inflatable form. Now, this is kind of the last effort, kind of the last option, because once you kind of choose this route, there's really no going back to having a normal erection. And so typically we want to wait at least 1 to 2 years to really kind of know where they're going to end up, because some guys, sitting out 1 to 2 years out will continue to have improvement. So before you kind of make that, jump to going to the surgery route to have a penile prosthesis implanted, we want to make sure that we've given it plenty of time for recovery. And there also may be a psychological component too, and that's where it can be beneficial to involve a sexual counselor as well.
I know for a long time that testosterone was an absolute no-no with a diagnosis of prostate cancer. I'm hearing more now in patients who've been treated successfully with low-risk prostate cancer, if they've been cancer-free for a while. What's the new data on testosterone as far as libido, sex drive, erectile dysfunction, and just overall male wellness with having a diagnosis of prostate cancer?
Yeah, certainly. And so, I think historically we were much more hesitant, and because especially once a man gets that diagnosis, if they are taking testosterone supplement, you want to make sure you stop that right away until the prostate cancer is addressed. But I think with some of the new evidence coming out, we're becoming a little less worried about restarting that testosterone, or at least we're being able to get them started much earlier on the testosterone supplementation, because certainly a lot of those men are symptomatic, and it can certainly affect them. And so it's certainly a discussion you want to have with your urologist, especially if you do have the low testosterone level after you get treated for prostate cancer and there's no evidence of recurrence. Your PSA, if you had surgery, it's undetectable. Have that conversation with your urologist about, when can you restart that? Because I think we're becoming more comfortable in getting men on that treatment much sooner now.
Very cool. Thanks for the update on that. So thanks for coming today. I've really enjoyed having you today on our podcast, You Are Not Broken. Can you remind listeners again where they can find the Prostate Health Podcast?
Thanks, Dr. Casperson. Listeners can find the Prostate Health Podcast on most major platforms, including iTunes or Spotify. You can also go directly to the website and listen to episodes, view show notes, and sign up for our newsletter at www.prostatehealthpodcast.com. And thanks again, Dr. Casperson, for having me on the show. I think what you're doing is just awesome, and have really enjoyed listening to your show.
Awesome. Thanks for being on this journey with me, Dr. Pohlman.
Thank you.